Hello, welcome to our informational session about OHA's Public Health Equity Grant, request for grant application. Next slide. My name is Kayla. I am a community engagement coordinator, and I'm a big fan of cats, as a lot of you know. Before we continue, we'd like to start with some Zoom webinar tips. This meeting is captioning and live interpretation available. For closed captions, please click the CC button on the bottom of your screen. This is a bilingual meeting. Please select your language of choice by clicking More button with 3 dots, selecting the interpretation icon with the globe, and selecting either English or Spanish. Instructions will be dropped in the chat. This webinar is being recorded and will be posted to the application website. Please mute your mic. Feel free to utilize the chat option. We'll have a Q&A at the end of the session, so we encourage you to hold your questions. We may cover the answers as we go along. Next slide. Please introduce yourselves in the chat box with your name and pronouns, your organization, and for fun, what county, I mean, we're all in Italy, right? What county are you joining us from today? Next slide. We'll start with sharing about who we are within OHA, talk about the Public Health Equity Grant funding opportunity and who can apply. Next slide. We'll start with sharing about, the agenda continued. We will also introduce the programs collaborating for this grant, the funding categories and eligible activities. We'll talk about requirements and show the application landing page, share resources and important dates, and lastly, open up the Q&A portion of the presentation. Next slide. OHA's commitment to community. We would like to share OHA's commitment to community. We acknowledge that there are institutional, systemic, and structural barriers that perpetuate inequity. These barriers have silenced the voices of communities over time. Oregon Health Authority is committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues. We recognize community-engaged health improvement is a long-term and adapting process. We're striving to engage with communities through deliberate, structured, emerging, and best practice processes. We're striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. Through this grant, we're looking for long-term relationships with community. Next slide. In this slide, you can see all the divisions within the Oregon Health Authority. Perhaps you've worked with some under different grant opportunities. We are the Public Health Division. Next slide. Within the Public Health Division, we have 3 centers and the Office of the State Public Health Director. All 3 centers, along with the Office of State Public Health Director, are engaged in a unique cross-sector collaboration for this grant opportunity. I am passing the mic to my colleague for the next slide.
Thank you, Kayla. Sharif Mohammed here. Good afternoon, everyone. Thank you for joining us. And my name again is Sharif Mohammed. My pronouns are he, him. And now I'm going to present to you the overview and purpose of this grant this afternoon. Oregon State goal is to improve healthcare access to all by addressing barriers in systems that make it difficult for communities to stay healthy. CBOs also have a vital role. We recognize that achieving this requires a multifaceted approach, with community-based organizations playing a critical role. Community-based organizations, CBOs, role is to have established relationships and trust with community-based members. CBOs help communities stay healthy by providing community-led and culturally relevant services. CBOs are an important part of Oregon's public health ecosystem. Next slide, please. We have priority populations for this grant, and these grants, priority populations for this grant are communities that experience health inequities, including, but not limited to, communities of color, tribal communities, disability communities, immigrant and refugee communities, undocumented communities, migrant and seasonal farm workers, LGBTQIA plus communities, faith communities, older adults, rural communities, houseless communities, and also some others that are not listed here. Next slide, please. Who is eligible to apply for this grant? We are accepting applications from the following types of organizations: 510c3 organizations, 510c3 partnership or coalitions of organizations, nonprofits with 510c3 fiscal sponsors, and federally qualified health centers. If you are a current public health equity grant recipient, you must reapply and be selected to receive funding beyond December of 2025. Next slide. Next slide, please. Who does not qualify? Entities that do not qualify for this grant include health systems, for-profit organizations, LPHAs or organizations contracted by LPHAs that fulfill LPHA's responsibilities outlined in Oregon Administrative Rule 333-014-0550. Next slide, please. Funding programs. Now we will dive into the available funding programs for this round of funding. There are 10 funding categories available to apply from, starting with communicable disease prevention, for which there are 2 subcategories. The first is prevention of HIV, sexually transmitted infections, and tuberculosis. The second is communicable disease with immunizations. Slide, please. Funding continued. Also, we have commercial tobacco prevention, overdose prevention, adolescents and school health. To be continued also. We have other categories include environmental public health, preventing environmental exposure for children, and the low material basin groundwater management area, domestic wells. And lastly, we have community resilience with also 2 subcategories. The first category is community engagement, community connections and empowerment, community connections and empowerment. And then the second one is emergency preparedness and response. And now I'm going to pass it to my colleagues in the next program to present to you.
Thank you. Hello, good afternoon. My name is Jillian Garai. I am a nurse consultant with the HIV, STD, and tuberculosis section at Oregon Health Authority. Next slide, please. In Oregon, we are focused on ending new transmissions of HIV, sexually transmitted infections, or STIs, and tuberculosis, TB, by using a syndemic lens. A syndemic is a set of linked health problems involving 2 or more conditions. These conditions interact to create an excess burden of disease in a population. Examples of these include poverty, housing instability, racism, stigma and discrimination, and criminal justice involvement. Many communities in Oregon experience an excess burden of disease for these reasons. We cannot end HIV, STI, and TB transmission without ending inequities. Community is a theme woven throughout our work through community partnerships, shifting resources to community, and supporting community-led needs assessment, education, outreach, and response efforts. The Oregon HIV, STD, and TB section works closely with many community partners to ensure people with these conditions and their contacts receive appropriate treatment and care, including connections to other needed services. We also educate providers and the public on these conditions and assist in developing public policy related to prevention and care for impacted communities. We have a funding range of $50,000 to $400,000 per CBO for this work and are looking to fund up to 20 organizations. Next slide, please. For this grant opportunity, the Oregon HIV, STD, and TB section is seeking CBO partners with experience working with populations at risk of HIV, sexually transmitted infections, and/or tuberculosis. Eligible activities for this funding include providing outreach services, which support local public health activities aimed at preventing HIV, STI, and TB in Oregon, and in ensuring people with these conditions and their contacts have access to health education, testing, and treatment services. Assisting people with accessing HIV STI testing. CBOs with a CLIA certificate of waiver and at least 2 years of experience providing rapid HIV STI testing and familiarity with state reporting requirements may be eligible to use these grant funds to provide HIV STI testing. Increasing community understanding of the importance of sexual and reproductive health and prenatal care. Providing harm reduction and risk reduction services such as condoms and sterile injection supplies to the community. Providing supportive services to people engaged in treatment for TB or STIs to ensure treatment completion, and conducting medical provider education and clinical systems change to support HIV STI prevention, care, and treatment. Please note that specific activities will be developed and defined in the CBO's approved work plan. No broad scope activities, such as those directed to the general public, are allowed with this funding, and a letter of support from the LPHA for the jurisdiction where grant activities will occur is required to facilitate coordination and prevent duplication of work. Thanks in advance for your interest. We look forward to hearing from you. I'll turn it over to the next speaker.
Thank you, Jillian. Good afternoon, everyone. My name is Nora Zimmerman, she, her pronouns. I'm joining you today from my home in Umatilla County. On behalf of the immunization program, we're so glad to have you joining us today to learn more about these amazing grant opportunities for immunization projects. The immunization program's focus is on reducing vaccine preventable diseases across the state. To do this, we partner with healthcare providers, local public health departments, immunization coalitions, and community-based organizations. As public health professionals, the immunization program's mission is to help improve the quality of life for all Oregonians. We do that by preventing and reducing the spread of vaccine-preventable diseases through immunization, managing immunization systems and services, and supporting evidence-based public health practices that make a lasting impact. Next slide, please. The immunization program is looking for projects that are community-driven, equity-focused, especially for populations most impacted by disparities and in counties without local public health authorities. Those counties are Curry County and Wallowa County. We're looking for initiatives that are developed through meaningful engagement with community voices and deep understanding of vaccine hesitancy, use culturally responsive and innovative strategies to reduce barriers to vaccination, and focus on building trust through outreach, education, and culturally responsive community engagement. Some examples include providing vaccine education, promoting vaccines and vaccination opportunities, building vaccine confidence with community, connecting people with vaccination opportunities, hosting or partnering for community events, engaging with local immunization partners such as local public health, convening local community partners to identify and address immunization barriers, developing culturally relevant educational materials and outreach initiatives to dispel vaccine myths, address concerns, and promote the availability and benefits of vaccination. For CBOs enrolled in a state-supplied vaccine program, clinical vaccine administration is allowed. Next slide, please. Oregon Immunization Program seeks partners who have experience with immunization efforts in community settings, are trusted messengers in the communities they serve, center health equity in communities facing obstacles to vaccinations, work with public health partners to improve and strengthen local vaccination efforts. The funding range for this category is $25,000 to $250,000 for up to 40 community-based organizations. Next slide, and I'll pass it to the Commercial Tobacco Prevention Program. Thank you.
Hi, Nora. Thank you. Hi, everyone. My name is Mario Castro. I use he, him pronouns, and I am the Tobacco Health Disparities Coordinator with HIPCADIB. And I'd like to discuss with you all the tobacco prevention component of the braided funding opportunity. Next slide. Next slide. Thank you. Commercial tobacco is harmful tobacco plant or nicotine products that are mass-produced and sold for profit by the tobacco companies. Tobacco that is sold by the tobacco industry, including cigarettes, vape, or e-cigarettes, chewing tobacco, cigars, and other products that contain addictive nicotine. The term commercial tobacco is used to separate it from sacred tobacco used by some American Indian, Alaskan Native communities, and tribal nations in Oregon to promote physical, spiritual, emotional, and community well-being. Commercial tobacco-related disparities are complex. They do not have a single cause or a single solution. OHA seeks to leverage community strengths and wisdom to address and dismantle the systemic root causes of commercial tobacco use that drives disparities within diverse communities. This is best accomplished through asset-based, culturally specific, community-led approaches centered in community voices and practices. The purpose of this grant is to leverage community strengths to address commercial tobacco use that drive higher rates in some communities. This funding opportunity will prioritize applications that address disproportionate impact of commercial tobacco use on Black, Indigenous, and people of color, and that also work with community members with intersecting identities. Next slide, please. The total funding available for commercial tobacco prevention is $6 million. The recommended range for grant awards is $25,000 to $200,000 for 18 months of grant funding. Activities eligible for funding include activities that connect to commercial tobacco prevention and cessation, activities that help reduce impacts of commercial tobacco. Examples of initiatives to directly address use of commercial tobacco include enhancing support for and access to culturally appropriate commercial tobacco cessation resources, or sharing information with community members about how they have been targeted by the commercial tobacco industry and what they can do about it. Another example is supporting tobacco prevention policy advocacy. More detailed examples are provided in the full RFGA document or online on the funding application website in the commercial tobacco prevention area. We also encourage you to take a look at the local tobacco prevention and education program contact list on the application website to connect with county tobacco prevention programs that are operating in your area. Next slide. There are a few additional requirements for organizations applying for commercial tobacco prevention funding. These include being a culturally specific organization, a racial justice focused organization, or an organization primarily benefiting a community disproportionately impacted by commercial tobacco that leads with race. Thank you, and that is my presentation. Thank you, everybody.
Thanks, Mario. Hi, everyone. My name is Josilia Johnson, Program Manager in the Equity Office, and I will be sharing overdose prevention slides. Next slide, please. All right. So the overdose prevention team focuses on reducing substance use and overdose disparities in Oregon. Our team is dedicated to working with communities to strengthen pathways to hope, healing, and health. These are some examples of the work we do. Providing data and information to better understand the overdose crisis and to better inform prevention strategies. Addressing the root causes of substance use. Connecting people to life-saving resources like naloxone and fentanyl test strips. helping communities link people to care to prevent overdoses and to help them on their treatment and recovery journeys. That includes helping link people to resources like housing, which are critical for both prevention and recovery. Reducing stigma toward people who use drugs, training healthcare providers on best practices for pain management and making sure they are prescribing opioids correctly, and more. For this funding opportunity, we are excited to partner with 3 community-based organizations, each funded at about $125,000 to reduce overdose disparities in our communities. These funds come from federal grants. Next slide, please. These projects will serve the communities who are experiencing the highest rate of overdose due to systemic inequities. Our main focus is to have projects link people to services and care. And we also welcome projects that will meet multiple community-specific needs. So an example of that could look like hiring a community navigator who can connect at-risk people to housing or treatment, and also educating the community about overdose prevention. Other examples include engaging communities with culturally specific outreach about the overdose crisis, harm reduction, such as teaching people how to use naloxone, and addressing underlying stigma. This could include things like listening sessions, events, community campaigns. The images on the slide show an example of a local campaign that was created in Lane County, and you can check this out at fentanylaware.com. Additionally, hiring community navigators who can connect at-risk community members with resources and services for basic needs, such as employment, housing, or food, harm reduction supplies and services, treatment services, and recovery supports. Peer groups that support harm reduction and recovery, addressing other barriers that the community is experiencing that would prevent overdoses and increase access to treatment, increasing your organization's capacity, for example, training and development for your team, and increasing community partnerships. Just as a quick note, overdose prevention funds may not be used for purchasing naloxone, drug take-back or disposal programs, or direct provision of substance use treatment programs. Passing it on to the next program.
Hi, everybody. Thank you for being here today and for your interest in this opportunity. My name is Callie Nichols. I use she, her pronouns. I'm a youth engagement coordinator, and I'm here representing the Adolescent and School Health Program. Next slide, please. Adolescent and School Health uplifts positive youth development work through our programming, which includes youth sexual health, school-based health centers, school nursing, mobile and telehealth services, and our own statewide youth advisory council. Our program priorities are health equity and youth engagement. Our program hopes to fund youth serving and or youth-facing organizations for positive youth development related activities. Positive youth development is about youth gaining a sense of contributing something of value to society, feeling connectedness to others and to society, belief that they have choices about their future, feeling of being positive and comfortable with their own identity. In addition to what is listed on the slide, positive youth development is about youth building strong connections and active involvement in all of the following areas: family, schools, training programs, workplaces, communities such as sports, religious activities, cultural groups, and peer groups. Positive youth development is typically measured by examining factors such as self-efficacy, self-esteem, resilience, social connections, and caring relationships, and community engagement. Next slide, please. Adolescent and School Health is excited to partner with 2 to 4 youth-serving or youth-facing organizations through this grant, and amounts ranging from $40,000 to $80,000 for the 18th-month grant cycle, to focus on positive youth development activities. So what does positive youth development work look like? Some eligible activities and specific examples include supporting youth-led centered workshops, training sessions, and skill-building activities. A specific example would be an LGBTQIA+ youth-led community workshop, supporting youth-driven campaigns and projects. And a specific example will be like a student-led development of a food bank and an after-school program, promoting positive connections for youth through mentor and or peer support programs, A specific example from a previous adolescent and school health partner is Push Movement hosting a youth skateboarding program with certified recovery navigators as mentors. Supporting youth advisory councils and youth action boards. Another specific example from a prior partner is Young Roots Oregon hosting an adolescent parent voice council, giving adolescent parents a voice in system and organizational care. Lastly, conducting a needs assessment with youth involvement for planning and implementation of youth engagement activities. These are just some general ideas with specific examples, but do not make up all of the possible opportunities for positive youth development activities. Thank you for your time. I will now pass it to the next program.
Hi everyone, my name is Jessica Hua. I use she and her pronouns, and I am with the Environmental Public Health section. Next slide, please. We are looking for proposals that strengthen community-based efforts to address health risks related to climate and environmental hazards. Some hazard areas can include addressing respiratory health impacts from wildfire smoke and air pollution, for example, asthma, preventing heat-related illnesses during extreme heat events, reducing climate mental health impacts, especially among youth, addressing community health risks related to water security, such as quality and access, limiting exposure to pesticides, pollution, and harmful chemicals, cultivating the health and wellness connections with community alongside cultural and natural resources, or it could be a combination of these and other environmental challenges that most impact your community. These disproportionately impact certain communities due to historical and contemporary injustices. Health risks tend to be greater for communities that have had lower access to resources such as parks, trees, pedestrian safety, and pollution controls. Many communities have not been involved in decision-making processes or have even been targeted by policies that create unhealthy living environments. We are offering a funding range of $75K to $300K and looking to fund 20 to 40 CBOs. Next slide, please. This program offers resources to build your organization's capacity and carry out projects to protect community from climate change impacts. There is a wide variety of what this can look like, and a few examples include creating cultural, community-centered educational materials. This can look like strengthening community access to shared green spaces through bicycle workshops and community gardening. Co-creating wellness programming alongside climate-adapted community spaces, which can look like creating land-based trainings for youth, peer discussion spaces, or incorporating storytelling to shine the light on how wildfire, extreme heat, and drought has impacted community. Can also strengthen networks with community members, groups, and decision makers, which may look like coalition building and celebrating community events. Thanks all, and I'll pass it to the next program.
Good morning, or good afternoon. I'm Dana Crosby. I'm with OHA's Toxics program, also within the Environmental Public Health section. Next slide, please. I'm here to share a bit about children's exposure prevention work and the PEACH funding opportunity, which is for 2 grants of $87,500 each. PEACH stands for Preventing Environmental Exposures for Children's Health and is part of OHA's Toxics program, which works to prevent exposures to harmful chemicals in communities across Oregon. Because we know that children are uniquely susceptible to harmful chemicals, we developed PEACH. Some of the ways that children can be exposed to harmful substances include industrial pollution, poor air and water quality, unsafe housing or recreation environments, contaminated food or garden soil, or pesticides. Children are more impacted by these harmful exposures than adults. Their growing bodies are developmentally susceptible, and they breathe in more air, drink more water, and eat more food per pound of body weight than adults. Children's bodies may not be able to break down and get rid of harmful chemicals as quickly or efficiently. They are also more likely to put things, like their own hands or toys, in their mouths. Teach's mission is to reduce exposures for children living in Oregon communities that are most impacted by environmental problems. Next slide, please. So, what does children's exposure prevention work look like? If you teach kids and families about health hazards or help your community access resources to protect their soil, air, or water quality, you're already doing exposure prevention work. If you're lifting up community voice and priorities about environmental health issues, you guessed it, you are doing exposure prevention work. This grant offers resources to build your organization's capacity and carry out community-driven projects that protect children's health. Each is unique because it offers an opportunity to collaborate directly with OHA staff and receive technical assistance from subject matter experts in various areas, like program development, evaluation, toxicology, risk communication, and support in developing education and communication materials or curriculum. Our most recent Peach grantee took a multi-pronged approach to exposure prevention and completed several projects, including holding focus groups to learn about community views on toxics in the home and organizing community events to raise awareness of local environmental issues. In conclusion, children can be negatively affected by a wide variety of environmental hazards, so there are many different kinds of impactful exposure prevention work. Please feel welcome to email us with any questions. We're looking forward to your ideas and working together. Thank you so much. I'll pass the mic to the next program, Domestic Wells.
Thanks, Dana. Good afternoon, everyone. My name is Sasha Ruddy. I use she, her pronouns, and I'm part of the Healthy Waters team, which supports the Lower Umatilla Basin Groundwater Management Area, LPGWMA Domestic Wells Program. Next slide, please. Community members with a private well in parts of Morrow or Umatilla County designated as the Lower Umatilla Basin Groundwater Management Area, LPGWMA, can access free well water testing for high levels of nitrate, which is 10 milligrams per liter or higher, and may qualify for free resources to have safe water to drink and cook with. Next slide, please. So the concern is people can become exposed to nitrate when they use contaminated well water for drinking and cooking. Formula-fed babies and anyone who is pregnant may be harmed from even short-term exposures. And everyone may experience harm from long-term exposures. Levels of nitrate at 10 milligrams per liter or more, which cannot be seen, smelled, or tasted, is harmful. Next slide, please. So for the CBOs applying for this opportunity, we are requiring participation in the outreach and engagement work group with OHA and other partners. During that time, we are co-creating materials, bringing the community voice, which is both concerns and ideas, to the table. Other possibilities include hosting events in the LPGWMA, giving information, hosting focus groups, tabling, and other activities to engage well users in the area. Another possibility is a systems navigator, which can help community members complete the application. The total funding available is $250,000, and we're hoping to fund up to 5 CBOs. Thank you so much, and I'll pass it on to the next person.
Hello, I'm Justin Torres. I'm a community engagement coordinator in the equity office. I'm going to be sharing more about the public equity grants. As we mentioned earlier in the presentation, the community resilience funding category is split into 2 parts. I'll be speaking regarding the community connection and empowerment subcategory. Our communities face unique challenges that shape their priorities and needs. Challenges like access to healthcare and mental health services, food insecurity and housing instability, social isolation and economic hardships, natural disasters, and health disparities. We know that a resilient community is one where people can maintain and improve well-being despite challenges and social disruptions. Our goal is to fund projects that help communities adapt to adversity and improve health outcomes. Projects that center locally tailored solutions and local knowledge. We hope to fund around 15 to 25 CBOs for projects ranging approximately $100,000 and $250,000. Our goal is not just to improve health in the short term, but to build lasting systems that center community and lead to long-term sustainable change and improvements. There are several priority health outcomes that this funding will focus on, including increased community access to health programs, resources and services, increased community engagement in local policy and health planning, increased access to health education, identify, prioritize, and address community identified needs, and decrease health disparities and promote equitable distribution of care. By focusing on these outcomes, we create long-term changes in the form of community-informed decision-making about their health, stronger social networks and trust, uplifted and underserved populations, policy and public health system changes, increased resilience in the face of crisis. These activities were chosen because they reflect what the community has told us they need. By centering local voices and using trusted messengers, we're creating health strategies that are in alignment with the community needs. And eligible activities, develop multilingual, culturally relevant health education, for example, through radio, social media, and peer outreach. Create inclusive community spaces for connections and cultural exchange. Expand the CHW and THW workforce to connect residents to care and support. Adapt OHA information into culturally and linguistically responsive formats. Align community efforts with local and regional community health improvement plans, such as CHIP. Increase coordination efforts and shared accountability for community-led identified health priorities. Of course, this list is not exhaustive, and interested applicants should review the RFGA for the full list. Lastly, we're looking for applicants that showcase community leadership at every stage, ongoing evaluation and learning, cross-sector collaborations with local organizations, groups, and local public health partners. And I'll pass it to the next group.
Hello, good afternoon. My name is Danielle Brown, and I am the Planning Chief in the Health Security Preparedness and Response Program. Next slide, please. OHA's Health Security Preparedness and Response Program serves as a primary coordinating office for our state's public health and medical response to disasters and public health emergencies in a variety of situations, including natural disasters like wildfires, winter storms, human-caused disasters and diseases, disease outbreaks and pandemics, and other events of public health concern. In our program, we bring together subject matter experts and rely heavily on our partnerships for success. We work closely with other public health division programs, other state response agencies such as the Office of Emergency Management, Oregon Department of Human Services, American Red Cross, and other local and tribal partners as well, such as local public health or other response agencies. So we are responsible for ensuring a coordinated public health response in such events. Next slide, please. Our mission and goals are on the screen here. What it really means is that our program develops and supports Oregon's public health and healthcare systems to prepare and respond in disasters and emergencies related to health. Priority outcomes in our program, priority health outcomes in our program include building organizational capacity to maintain operations during both normal and crisis situations by developing a skilled workforce, flexible processes, and consistent services, as well as strengthening community preparedness and planning for disaster and emergency response. The available funding range for the CBO grants is $25,000 to $400,000 for up to 40 applicants. Next slide, please. This slide has examples of emergency response capabilities and what we would be looking for in projects. Eligible activities might include engaging communities, especially those who are higher at risk in local emergency preparedness planning. Ensuring interpretation, translation, and outreach is conducted to diverse and marginalized populations who are more at risk of being affected by emergencies and disasters. Helping reduce structural barriers and access to resource allocation. Resources could be vaccines, shelters, food, etc., that to help make them available to communities who are most at need. Workforce competency, so training emergency service providers on the needs of specific community members in public health emergencies. Community resilience building would mean promoting household emergency preparedness to help reduce individual and community vulnerability before emergencies occur. And another area we've seen CBO support in recently is in the different disasters that have happened, such as wildfires and flooding, where they have been able to increase wraparound and social support services to folks who have lost their homes or other situations during disasters. End of slide. Thank you.
Hello, everyone. My name is Ashley Hewling. I am a community engagement coordinator on the Public Health Equity Grant team. So I'll speak a little bit more on eligible activities. So each funding category has detailed descriptions and examples of the types of activities this grant can fund in the RFGA document. This slide summarizes eligible activities, which include outreach and engagement, community engagement and empowerment, data collection and community-led research, prevention initiatives, workforce and leadership development, policy and systems advocacy, collaboration and cross-sector partnerships. Please refer to the eligible activities under each funding category for more specific examples per program. Next slide, please. We also want to take a moment to give a shout out to our local public health authority partners. As we mentioned before, eliminating health inequities requires many approaches and a lot of collaboration. LPHAs are crucial in this work. As such, we encourage partnerships and alignment with your local public health authorities for this work. Please reach out to them using the contact list provided on the application landing page. A letter of support from the LPHA for county of proposed project is strongly encouraged. Next slide, please. Now that you've learned about the programs and funding categories, let's get into what the application requirements are. Your application will require an upload of your or your fiscal sponsor's 501c3 determination letter so we can verify your status. You will have to answer questions about your organization and questions that will detail your project plan. You will also need to submit a budget for that project. The budget questions are built into the platform. If you're applying for multiple funding categories, you must complete a separate set of project plan questions and corresponding budget for each category. For example, If I'm applying to receive funds for a tobacco prevention project and an overdose prevention project, I will respond to project plan questions for my tobacco prevention project and fill out budget questions for that project. Separately, I will answer project plan questions for my overdose prevention project and fill out budget questions for that project. Each program is reviewing for their respective funding categories. You will need to upload 2 letters of support from entities you have worked with. This can be from LPHAs, other CBOs, schools, other funders you've worked with, etc. We will provide a template for these letters. Lastly, there is a form in the application portal called Applicant Info and Certification Sheet that you are required to fill out as well. I'm going to pass it over to my colleague for a high-level demo of the application portal. Thanks so much.
Thank you, Ashley. Hi, everyone. This is Jessica Beltran, pronouns she, her, ella, and I'm a community engagement coordinator and the team lead for the request for grant application process. So I'm going to share my screen really quick. Bear with me. Okay. You should be seeing a web page with a black banner that says Public Health Equity Grant. Can someone confirm?
We see it.
Yay. Okay, everyone, this is the application landing page that we've been mentioning throughout this session. So I'm going to share with you how you can register your organization to start the application process. But first, I want to share with you this landing page that is full of resources. So I believe Jody will be dropping a link in the chat to this landing page, and we'll also send it in a follow-up email. So some highlights of this page: when you first arrive at this page, you'll see some important information here at the top. I want to highlight the funding opportunity closes 8/22 at 5, and it's listed here. And so at the very top, there is this button. Click here to enter Web Grants application portal. And this is where you're going to register your organization to apply for the grant. Before we click on that, again, I want to continue with highlighting some resourceful aspects of this landing page. And starting with here, the areas for funding that we just covered are all listed here. Some eligibility information is listed here. And then scrolling down, you'll see the grant informational sessions like the one that we're currently in. After each session and within a couple of business days, we replace the registration link with a recording. So you can go back and see previous sessions, even though it's the same content. If it's helpful for you, those links are available, as well as links to register for upcoming sessions. So we have the ones in English and the ones in Spanish. Also, I want to highlight our open office sessions if you haven't already registered. And these are, as indicated, open office for you to pose budget or technical related questions once you obtain all the resources that you need and are moving forward with your application. If you stumble across any questions regarding the web grants application or any like fiscal guidance that you might need, you can show up to these sessions to ask questions. So those are available for you as well. And then in this section, we listed links to get you ready to apply. And so some of those resources, again, there's the application portal is sprinkled throughout, but we have the downloadable RFGA document, and this is where all of the information that you need is here. So we have English version, Spanish is coming soon. So definitely first step would be to look at the RFGA. And there you'll find the various funding categories or priority health outcomes and eligible activities that they provide. And we also have in separate templates the organization questions that we ask and the project plan questions that we ask. These are templates to help you prep. And then you can copy and paste them into the actual application portal. For anybody having trouble opening these links, they are also part of the RFGA. So they're there and they're here as separate templates as well. We also have a budget worksheet to help you prep your budget. We have a fiscal guidance document that lists allowable and unallowable expenditures. And then we have the RFJ scoring rubric with the questions that we're going to score, the points and the things that we're looking for. So it's also an available resource to you. And again, rubric is included in the actual RFGA. These are just separate templates to make it easier to find. And then over on the right, you're going to find attachments that you're going to need to upload in your application. So we're going to need that 501c3 determination letter from you. We're going to need those 2 letters of support. And we have a template available in case you want to provide whoever you request a template. I know some folks just write letters, but there is a template available if needed. And these attachments are required in your submission. At the end, it will ask you, okay, upload attachment A, B, and C. We just have them here prepped for you to download them and have them ready for when you submit your application. So you will see that in the portal toward the end. And then again, here's the application portal. We're almost to the part where I'll show you the actual application portal, but a little bit more resources here. We have the slide deck. Somebody asked earlier where they can obtain the slide decks. Here they are. We have a frequently asked questions guide, which we ask you to look at. It has a lot of the questions you've been asking in the chat. And then this is the LPHA contact sheet. Again, somebody asked in the chat, how can I find who I need to reach for a county? This sheet contains contact information for each county. Please only use this, the folks listed on here. And then other general resources, how to write an effective grant proposal, how to get a unique entity ID if you don't have one and don't know how. And then we also always like to list our partners, Nonprofit of Oregon, Nonprofit Association of Oregon's resources. So there's a resource library here. We have a guide on how to use web grants because we're aware this is a system that not everybody has used. So this is a Word document with screenshots, and we're working on getting you a video tutorial soon. And now we're at the bottom of the page. You can join our listserv for any communications related to the RFGA. And this is our email if you have any questions that you want to ask us. So that is a lot. That's everything that's on this landing page. Again, these are all resources to help you be ready. And now I'm clicking the actual Web Grants portal. So Web Grants is the application that we're going to be using for grant management beginning to end. And so with you all, it starts with the application part. And for us, we'll be using it to review. We'll also be using it to award. We're going to use it for ongoing grant management from beginning to end. So for now, someone's unmuted. For now, when you get to this page, you'll see announcements. This RFGA landing page will link you back to the landing page we were just on. We also have the RFGA document here itself. So what you have to first do is click here to register. And you're going to fill out all of this information, this organization information. These questions are on one of those templates that I had just shown you. So again, you can prep them there and then move them here when you're ready if you would like. So these like mission, history, all that stuff is on that template. So you're going to fill all that out. It does have character limits there listed for you. And so when you're done with that, you're going to save registration information. And something to know is that Web Grants is a 2-step process and that you fill this out and you submit it. And we on our back end, we have to accept your registration. And there isn't like something that you have to meet for us to accept your registration. It's just the way that the system works to avoid like duplication of account creation. So you'll submit that. We'll get an alert on our end to accept your registration. And we have to, again, just verify some things and then click accept. Then you'll get a notification letting you know your account is ready for you to move forward with filling out, applying for the specific category that you're interested in and filling out your project plan questions and everything else. So right now it's taking us about 1 business day to accept your account. So just giving you a heads up about that as well. So yeah, that is my share on the landing page and the actual web grants application portal. And feel free to email us if you have any questions. I'll hand it back to you, Ashley. Ashley, are you ready?
She might have stepped away. We can move on. Give me just a moment. I can pull it up.
I can be Ashley for a minute.
Oh, thank you, Kayla. Go for it.
So we were at upcoming office sessions, is that correct?
Apologies, folks.
Oh,
Thanks
hey.
so much to my colleagues for being willing to step in there. I had a little issue. Yeah, technology has not been my friend today, but I am here and jumping back into it. So we'll be sharing tips and where to find resources in the last portion of our presentation. Next slide, please. Ooh. Here are some tips that might be helpful. First, read the entire RFGA. It is lengthy, but it has all the information you need. Ensure your project aligns with the desired health outcomes for the program you are applying to. Check out the eligible activity examples they list. Ensure you understand minimum qualifications and submission requirements. Prep your answers on a downloaded template before you submit through the application portal. Next slide. Unless a specific program states otherwise, these unallowable costs apply universally. Unallowable costs include direct medical or behavioral health services, vehicle purchases, research, political action, i.e. lobbying, supplanting state, local, other non-federal or other federal funds, or state-covered services or replace services. Capital expenditures above $5,000 per unit must be pre-approved by OHA. Please refer to the fiscal guidance document on the application landing page to reference allowable and unallowable costs per program. Next slide. So some of the other resources that exist include guides. We've created an FAQ guide to address common questions we anticipate you might have. We encourage you to review it before reaching out via email, as you may find the answer there, potentially saving you time waiting for a response. Y'all know sometimes we take a little bit of time. Our inbox tends to get especially busy during this period, so thank you for the grace. Some other guides we have available include a web grants guide with screenshots and a recording navigating the platform. We also have a fiscal guidance document that lists unallowable expenses more in depth. We also uploaded a video on how to acquire a UEI if you don't already have one. We also provided language resource links for our non-English dominant applicants. For templates, you can find, as previously mentioned, organization and project plan questions, the scoring rubric that will be used to score answers, a template you can provide for your letter of support request if needed, and a list of local public health authority contacts you can reach for letters of support or to plan alignment of project/activities. You're welcome to attend other info sessions, though the presentation materials will remain the same. We also offer open office sessions where it will be open floor for application and website questions. We will record all of these sessions and they will be posted on the application landing page. Next slide. So here is a list of things you can gather to help get you started. A letter of support, your 501c3 determination letter and number, download the question templates to help you prepare, review the FAQ guide, watch the Web Grants platform recording. And here we have the dates for our next session. Looks like the next one will be on the 15th. 12 to 2, that's for our English session. And the last Spanish session will be on 7/16 from 3 to 5. Next slide, please. This will also be very helpful. I can't encourage you enough to definitely come to an open office session after you've, gone through the process, seen what it looks like. These will be very, very helpful to get, real-time perspective and help. Next slide. There are many important dates here, and the one I want to highlight is our question period close date. We can't answer any questions regarding this grant opportunity after August 6, 2025 due to contract and procurement rules. Any questions received August 6th will receive a reply advising so. So please keep that in mind and make sure you plan accordingly. Hopefully you're not a procrastinator like I am. And for the next slide here, we have our team's contact information. Please reach out if there's any question we can answer that you haven't found in the resources we have provided, or by maybe rewatching one of the videos, should you like. That's also a very helpful resource. And next slide. Thanks so much for your interest, and we look forward to seeing your applications. And now we will move on to the Q&A portion for the remainder of the time. Thank you.
Thanks, Ashley. All right, y'all, what do you have for me today?
I have a question.
Yeah, go for it, Christine.
There have been several mentionings of LPHA. It's not clear which grants require LPHA, which grants do not, and can the city of X, Y, and Z count, or does it have to be LPHA?
Yeah, thank you so much for asking for clarity on that. So very generally, the LPHA letters of support is a very strong recommendation on our part. You will not get disqualified if your letter of support is not from an LPHA. We prefer it to be for coordination. With the caveat that it looks like for HIV, communicable disease HIV, they do request a letter of support because of the nature of the work. Just want to recognize that wasn't super clear in the layout of our RFGA, and we'll work toward ensuring that that request specific to that program is clarified, saying it out loud for now. And so, Christine, for the LPHA contact list, again, we made that available for ease of access to know who to reach out to for the letter of support. And yes, it can be from a different entity that you work with that can speak to your work. So if that's, the city for you, then that works.
And I asked that for full transparency, and I'm speaking not just for myself, but for many CBOs. When you say LPHA, it's very hard to reach them and it's very hard to get a response from them. So I'm hoping that OHA has talked to LPHAs about being accessible to CBOs because they're very hard to be accessible to or to even try to get on a meeting with them. That's why I'm just a little bit frustrated about the LPHA thing from past experience.
I so appreciate your transparency, and it definitely has been a learning experience. We've met with them for a couple of times for the past 6 months to kind of set up this need. So LPHAs are aware. They provided the contact information for us. Likewise, we are aware that we are in a very challenging time, and there are staff limitations, and that's true. And it definitely can be the case that you reach out to an LPHA and that they don't have capacity to respond, and that's not on you, which is why we don't penalize for not having a letter of support from an LPHA. And I see a question in the chat about the funding range. And the funding ranges are on the RFGA. They speak to per organization and then about how many the program anticipates to award, and it's an estimate. So these ranges are per organization, per grantee. Hi, Michelle, I see your hand.
Hi, Jessica. Just a quick eligibility question. Would a veteran peer support program be eligible under the Community Resilience, Community Connection, and Empowerment?
My first question, Michelle, is are you a 501c3 organization?
Yes, we are.
Great. Then we look forward to your application.
Thank you so much, Jessica.
No problem. I see Melanie's hand.
Hi, thank you. Okay, where did you say we find the contact list for the LPHAs?
It's on the application landing page. I see that Cecilia dropped a link. And it is tucked under the section that says helpful links in the pale blue. And then there is LPHA resource. And then there's a link that says LPHA contact sheet.
All right, thank you. And then, so for example, my organization would be looking at the Community Connection and Empowerment Grant, which has the funding range of 100,000 to 250,000. So just to be super clear, like the minimum we would request to our organization would be 100,000.
Yeah, that's a guideline, Melanie. I mean, if you are requesting for a project that you think is under that, we encourage you to request for a funding amount that will help you achieve the activities that you are set to do toward your objective. So, yeah, whatever it is that your organization feels like you need to be successful in your project.
All right, thank you. And can I ask something else about the LPHA? So, like my organization, I mean, we have a lot of crossover with for example, patients of the local county health department or something, but we have no established partnership or relationship with, Multnomah County Public Health Department. So I'm not, is it going to be a lost cause, approaching them for a letter of support?
I wouldn't think so. And my perspective is, Melanie, if an LPHA learns about the project that you're doing within their county, I can't see that as something other than a benefit, right? At least they're aware that your organization does X, Y, and Z, and that you have this project, and that these are the people that you're serving and activities that you're doing. And so at minimum, it's awareness of what partners are available to each other in a county. And so to me, that still ultimately ends up being beneficial, right? It's always great to know who in our county is doing similar work. So that's my perspective on that for you, regardless of whether the outcome is a letter of support or not.
Okay, that's really helpful. Thank you.
Of course. And
Alejandro next, and then
yeah,
it's be Jessica.
Doctor Alejandro, hello.
Hola Jessica, voy a hablar en español porque me es más fácil, Jessica. Sí, tú dijiste que este era un proceso de 2 pasos, ciertamente. Nosotros cumplimos ahorita con el primero y el primer paso es que registrar la organización. Pero hay varias preguntas. La primera es, dice, el correo que nos mandaron de vuelta, dice que cuando uno registra la organización, ese es un primer proceso de aprobación. Pregunto yo, ¿hay alguna condición que hiciera que OSHA no aprobara? Porque hay una serie de preguntas pues, que hay que contestar ahí. Entonces, segundo, dice que van a enviar luego un nuevo username and password para entrar en la misma página que tú enseñaste, para, pienso yo, poder abrir la aplicación ya en sí del grant. Entonces, quería saber si eso es cierto. Y por último, con respecto otra vez a la LPHA, es si el trabajo que se está haciendo es netamente educacional, no se trabaja directamente con dando recursos a pacientes, etcétera, todavía es considerado muy importante la carta de recomendación en ese caso. Estas son las preguntas. Gracias, Jessica.
Doctor Alejandro, como estoy en el canal de inglés, voy a hablar en inglés, pero parece que la traducción se le va a hacer en español. So just letting Dr. Alejandro know that because I'm in the English channel, I'm going to be speaking and responding to him in English, and he should be receiving my response in Spanish via the translator. Regarding registering for web grants, registering your account, there isn't a requirement that you have to meet for us to approve that profile. It's just the way the system is built. And the purpose is sometimes there are organizations where multiple people work on a grant, and sometimes accidentally folks from the same organization can create multiple accounts. And so there's a duplication of accounts for the same organization. And so WebGrants sets up their system in a way that by internally approving, like reviewing who is registering and approving that account, that we can try to minimize the duplication of profiles per an organization. And so it sounds like you were able to register. It sounds like you were able to get approved and got a notification about a new user and password to move forward with the rest of the application. And I missed if there was another part to that question regarding web grants.
Sí, no, nos llegó el correo de que en varios días hábiles nos va a llegar el nuevo user y password para poder entrar y ya empezar a trabajar en la aplicación del grant. Eso fue. Y si la carta de LPHA depende del tipo de trabajo que se haga. Si es solamente netamente educacional, todavía sigue siendo bien recomendada la carta.
Yeah, okay. Thank you so much. So it sounds like the web grants question comment was addressed. It sounds like you were successful, received a communication saying you'll receive user and password, which is what should happen. Regarding the letter of support, again, I just want to really strongly emphasize that letters from LPHAs are a strong recommendation and not a requirement. Again, our whole goal is to connect CBO work to LPHA work. And letters of support help us do that at minimum by you reaching out to them and saying, hey, I'm applying for this grant. This is the work that I'm going to do. Is there an opportunity for a partnership here? Yes or no? And do you support my work, or do you have any feedback on this project that I have planned out? And they might say, like, this is an example. They might say, actually, we need an organization to help us with a community assessment. Do you want that to be an activity? We could partner in that manner. So there's these opportunities for cross collaboration. That's like the best case scenario. And then again, at minimum, they don't have capacity, whatever have you. At least they're aware that you are a CBO that exists, that is doing this awesome work.
Jessica has the next question.
Hi, Jessica.
Hi, thank you. I'm following up on my question in the chat about my CBO. We have a couple of different programs within our organization that are looking to apply. And I was wondering if there's a maximum award for CBO. So say our HIV program or our sexual health program and our climate and health program both applied. We do very different work. And so we would be applying under different categories, of the 10. Would there be a maximum amount? Like, could we only receive, say, 100,000 because it's a single organization, or would you fund each program or each application, on its merit?
Yeah, thank you for that question, Jessica. And so there's two parts to this. Each program has their own individual caps. So like EPH will not exceed this amount, and then tobacco will not exceed this amount. And so there's a program caps to be mindful of. And then we have an overall cap for organizations that are going to apply to multiple categories. And by the way, that is the whole goal of a combined grant opportunity, is to give you all the opportunity to apply to multiple categories. So yes, that's great if that works for you, and if you have multiple projects that apply to multiple programs. But we do set an overall cap that no organization can be awarded more than $750,000. And again, this is for that scenario where one CBO wants to apply to multiple. It's an overall organizational cap to be mindful of. Did that help you answer your question, Jessica?
Yes, that's very helpful. Thank you.
No problem.
And I apologize. Someone else had their hand up, and I think I clicked a little heavily and put their hand down. So someone else had a question. Oh, Andy, there you go. Thank you, sir.
Thank you. Hello. I work with a 501c3 who works with nutrition incentive programs through farmers markets. And we're still contemplating what sort of project we might want to apply for. But one thing that we do is provide support stipends for those farmers markets to be able to enact the program. And I wonder if funding like that would be allowed in this grant.
Andy, can you tell me a little bit more about what support stipends are?
Sure. Yeah. So we work, the nutrition incentives work through SNAP. And so the support stipends go toward farmers market staff to be able to implement that. So for them to buy an EBT machine and be able to count participants and do data collection and whatnot, it takes a lot of time and energy on their part, and we try to supplement that.
So is it like stipends for participation of community members?
Kind of. The direct service aspect of the program is SNAP matching through farmers markets. And so SNAP participants are getting separate funds to shop at different farmers markets, farm stands, and other places. But the money I'm talking about goes directly to farmers market staff to support them in implementing that work.
I
That
see.
makes sense. Okay.
Yes. Yes, and so very generally, like direct rep supports generally are not an allowable expense under this grant. But what you're telling me is kind of like a participatory incentive for your workers, and that is an allowable expense as a gift card. And we do have guidelines on how like what the limitations are and there's some amounts not to exceed that you need to be mindful of due to IRS things. So it shouldn't be your standard way of paying staff. However, there is an incentive portion for staff, and we speak more to that in the budget guidance document that we have on the application landing page. So then for you, Andy, in your budget proposal, you would say, I need this amount for volunteer stipends, and then you would narrate how it is that they're getting those stipends and how they how it is that they contribute to the overall project.
Right. Okay, thank you so much. I saw the gift card information. I wasn't sure if it applied or not. So thank you. That's very helpful. Appreciate
You're
it.
welcome. No problem. And then I see Arthur's hand.
Yeah, thank you. If we have a CHW training program, can we, when participants graduate, can we pay them for some on-the-job learning time?
This is such a good question. I wonder, okay.
Is this like an internship, or can you speak a little bit more to that, please?
Yeah, I mean, it would be it would be a chance to do some learning with our nonprofit. So we'd stand up the training program, and then after they complete the 83 hours or whatever it is, or maybe along with that, I don't know the answer to that yet, they could work with staff who are doing CHW/case management type of work to learn on the job, and can they be paid for that time as presumably employees?
Okay. To me, that sounds totally in alignment. Again, like Jessica mentioned before, just detailing these things out in your budget narrative would be really important so we can connect the
Right.
dots to what we see in your work plan and what we see, I'm sorry, in your project plan and what we see in your budget.
Great. Yeah, and as I said it out loud, I realized, well, that's staffing, and you pay for staffing, so I don't think it would
You
work.
got
And
it.
my other question, I think we've already answered, but if we have healthy shopping trips where we have like education, and then they get, a $25 or $50 gift card to go shopping and buy healthy food, I think that would just count under the gift card rules. Is that correct for participants?
Yes. Give me a second to just like let your question marinate for a moment. So,
I know I've been bugging you all with a lot of questions, and I appreciate it.
you're keeping us on our toes,
All
Arthur.
right.
I do appreciate the questions. And we might have to get back to you on the web grants question if that is okay. I have emailed someone.
Sure.
So this would almost be like a gift card incentive. It's great that it's paired with education and outreach and like a hands-on demonstration and learning. And so you would just need to be mindful of the gift card limits in our budget guidance.
Right. Thank you so much.
April.
Hi, yeah, I'm wondering if an organization applies in multiple categories, are they each evaluated separately, and awarded separately? So like if they were to apply for like 750,000, is it all or nothing, or can some of it be partially funded, or do you have any thoughts on how that works?
So the 750 is the cap, and that's for any one organization. You will see in the RFGA document the funding caps per program area. So that's really laid out nice and clearly. And there are circumstances where OHA might see, like, an organization has requested 100,000, and we might, offer less, but we would let that person know this is what we're offering, and then or whoever receives that can decide if they want to take it or not. And did that answer your question?
Yeah, I think so. And so if someone was applying in multiple categories, so across like several things, so it sounds like they might be awarded like a portion in each one. Like they may not get the full amount, but it could be that portions of each could be funded.
I see what you're saying. So, like with the specific example, like if an organization was applying for um, community resilience and emergency preparedness, they have a $400,000 cap, and they also apply for community resilience empowerment. That's a 250 cap, and then they apply for tobacco, and their actual ask is above the 750. Then it again, because of all of the applications are reviewed individually. By the areas, we will make those funding decisions, and then no organization will exceed the 750, even if they've applied for funds that actually do, if that clears things.
Yeah, definitely. I think that makes sense. So they're kind of reviewed independently of each other and not. Yeah.
Yes.
And then in the end, yeah. So like I think we're thinking about applying for more than one, but we weren't going to have our total budget exceed 750 just to avoid that to begin with.
Oh, awesome. Thank you.
Yeah, thank you.
Yeah. And I just want to say, I know this in the crowd, there's a mix of organizations that are currently funded, organizations that were funded in the past, organizations that are hoping to be funded, and LPHAs. And like we thank all of you all for being here. For our currently funded CBOs, just saying out loud that if you're interested in being considered for this funding, you will have to reapply, set up a registration, just like everyone else. This is kind of like a clean slate grant opportunity. So everybody, this is open to everyone, and you will have to do the same steps to apply, even though you're still being funded through December. Okay, Miss Martha Mercy.
Yes, it's me.
Hi.
I'm glad you recognize that. Anyways, my question is, how do we or your team apply equitable lens so that one organization does not apply for three categories and receive those three categories, whereas one person applied for one thing and they didn't receive it? How do you make sure that that kind of equitable lens is not applied? Thank you.
Thank you for your question. It's a great question, and I will say this up front and out loud that, just being very frank, like we don't have the funding to fund everyone. It's just the reality of our situation right now. What we are committed to doing is looking at all of the applications. Our goal is to have representation statewide. That is something that we aim to do every time we do this grant. And each time we're hoping to get closer. We haven't quite hit the mark yet, but that is one of the goals of ours, is to try to have representation in all of the counties in one way or another. We also look at, after individual applications are reviewed, we also look at the full picture. So we look at the applications holistically in making our decisions as well. So there's a couple of lenses that we do review the applications for. One thing I will say out loud is that Our reviewers are also instructed. We know not everybody has the resources for, hiring grant writers and that sort of thing, and we do take that into consideration as well, because just again, looking at it through an equitable lens. So do send in projects, clearly explain it to the best of your ability. Really try to align it, really read the RFGA. We cannot say this enough. Like, mostly all of the answers to a lot of your questions will be found in the RFGA and the FAQ. All of the questions that you all are answering now will end up in the FAQ as well. But hopefully that gives you an idea, Martha, of like how we're looking at these.
Thank you. I appreciate that answer.
Go for it, Christine.
Okay. So I hear you say we, but most of us in this space know OHA has a tendency to be biased towards larger organizations. They just do. Don't care how you look at it. So again, what I would like clarification on is, as you talk about this equity lens, which by the way, OHA says that every year and it never is. What is your response when you don't get a grant? Because usually, well, actually, every time you don't get a grant, there's a letter from OHA that says, you didn't get this grant. We don't have capacity to tell you why. You don't give scores. You give no explanation. There's no room for growth. As you said, smaller organizations don't have funding to do fancy grant writing and do the work, but may not always be able to explain the work, but they do the work. So are you set up, you as an OHA, to recognize the difference? Because history has shown that OHA does not. So how is this any different? And I'm asking because many of us, many times apply, we're always denied. We don't want to keep applying, no matter how many grants. If all you're going to do is deny us because we're not using the right language or our words don't flow because we don't have a grant writer and we're doing direct service while writing these grants. So how is this any different than what they always have?
Thank you for your question, Christine. Like I said before, we do look at this through a lens, and we are very, when we look at these applications, we are looking for the projects. We totally understand that not everybody can hire a grant writer. We've funded organizations that are new and emerging. We've funded larger organizations. It really is a mix of organizations that our program area or this grant, the Public Health Equity Grant, has funded. I can't speak for the entire history of OHA, unfortunately, but I can say from the lens of this work, we call out, especially the first iteration of this grant, we call out, we're looking for organizations that are newer, organizations that are doing culturally specific work. Like, we're really intentional with that language in our RFGA and in our call for applicants. To answer your other question, with feedback, feedback is something that is something that we hope to improve upon, because as much as we want to give feedback that can really be meaningful and impactful, it can be difficult with the volume of applications that we do receive. And so as we move forward, again, this is just the third year of the Public Health Equity Grant existing for our equity office. We do hope to get better at providing feedback, but this is something that is a work in progress, I will say.
I'm going to jump in and add here. And Christine, really appreciate you feeling comfortable enough to share your opinions with us. Something else that I want to highlight is the scoring rubric that we have. And we have made edits to the things that we ask and how it is that we're scoring. So you have a scoring rubric available to reference the various points that what are the answers that we're seeking here. There's that. And just the best advice that we can give is, does your project align with that program's priority health outcomes? And were you able to narrate how it is that this project aligns with that or is going to help you achieve that, and how those activities will work toward this goal? So that's something else that I do want to recognize, that there is some type of being able to tell that story, and that involves writing. So definitely want to acknowledge that it does take some level of writing skill to be able to tell that. Hopefully the rubric can be of support to you in writing those answers. And now when it comes to feedback, as Jusilia mentioned, capacity-wise, sometimes we don't have the ability to provide tailored advice on how to move forward, not only because of capacity, but also we'd be speaking very specifically to our grant. And that may or may not help you in other grant applications, but do know that there is a process for a records request. If you want to obtain your scores, that is possible. If you email us saying, I want to see what my scores are, then we follow a process, because everything that we do is public record. And so we would just have to follow the process of requesting public record, requesting your scores. And that is something that is available. We won't hide that from you if you need to, but there is a process that we need to follow. Now, for this time around, we're hoping to build in feedback boxes for reviewers that they can provide information on any possible feedback that might help you. But we understand that end of the day, this is very specific to the questions that we're asking and to this grant. So yeah, there's just that on that. But again, really hoping that the time and effort that we put into the rubric is a benefit to you in crafting your answers. Also, I can't plug specific tools, but there are a lot of tools now available in this era of technology that can help you. So I invite you all, I see you chatting. I invite you all to share with each other what those tools are, and appreciate those of you plugging tips in. I see Lauren's question about reviewers. Reviewers are the program staff. So those are the teams of the people that presented today for their respective programs. That is who is reviewing. They are the ones leading their program element. They are the ones that wrote their priority health outcomes, the eligible activities, presented the material to you, and they are the ones that will be reviewing your applications to ensure it's in alignment with their priority health outcomes and activities and goals. So that's how there was no selection. It's the program that joined this grant opportunity and their team. And now the other reviewers are local public health authorities that want to participate in reviews specifically for environmental, public health, communicable disease, and health security preparedness and response, which are what we call modernization programs. And LPHAs help us review those because of the alignment and the work that they do in those categories as well.
The email that you sent, which is a general box for all of these programs, apparently, right? If we have an idea of what we want to do, but we want to save ourselves time and OHA time before we even write about it to see if it's something that would be considered, Is that the same email we should send? Say, I don't know, I want to do X, Y, and Z for this grant. Is that something you think would be appropriate and receive a response before we spend so much energy writing about that topic?
Thanks, Christine. That is the same inbox. We have a single point of contact. And what I do want to tell you though about activities, we do have folks that send really specific, I want to do this, this, and this. And for equity reasons, we really can't steer you in terms of like modify it this way or say this instead. Again, we just can't tailor responses in that manner, and we'll probably point you toward, okay, what program is that for? Have you looked at their priority health outcome, and do your activities align with those that they listed as examples? And so we'll probably respond to you very generically because we can't respond in a detailed manner to everyone for, again, equity purposes.
Arthur, I did not get a response back yet from our web grants host, so I just wanted to let you know. I will say this though, the first part of the registration, it is asking like general questions about like the mission and vision of your organization and questions like that. All of it is, if you want to preview the questions, it is on the RFGA landing page. So if you wanted to prepare your answers and just in case you're unable to go back and edit, then you're able to just copy and paste those into the system.
Yeah, the reason I asked specifically is because it asks like how this project will impact the populations, right? So hopefully it's editable, but we put in good text and it'll work out one way or the other. But yeah, I'll look forward to that response and thank you.
Mm-hmm.
I think we got all the questions in the chat, but if your question got lost, feel free to raise your hand and ask. So I think we have close to 10 minutes left, so I'll just give a few seconds of silence here for any other questions that might come up in the next few minutes.
I have a quick question
Hi.
/ comment. So during one of OHA grant period, and it's kind of funny how it always says this grant is for this population, this population, this population, and that session of that grant, they added so many other population to it, and basically most of the color organization were left out, and more, like color organization received this grant. And I don't know how you're going to describe my terminology because something you say and you say it's racist or it's not racist. I'm not trying to be racist here. But most of the time, the grant tends to lead towards other organizations than the organization that is actually supposed to apply for this grant. And we are still talking about equity lens. I know you tried to explain how you're going to make sure, and based on how the grants are writing, that people are considered. I just thought about that, and because I was so relaxed in our grant, thinking that you've been a stepchild of OHA, you would get this grant, and because they added other organizations that you never even know about. I guess I'm making this and it's not making sense, but we have been on this platform advocating for grant, advocating for all kinds of things to happen in Oregon. And then it is happening. But then you broaden your spectrum so much now that you have so much to deal with, to the point that people who really have been advocating for this grant and sometimes are left out, and I hope I'm making sense. But I still know that without OHA grants, I wouldn't be here in this office. I wouldn't be doing this work that I do, because you guys do recognize little organizations and you do your best to make sure that they thrive. Notwithstanding, when it comes to these big grants, the spectrum is so broad that people or organizations that have been in these meetings and been advocating for so much to happen, sometimes they are left out. Because that particular grant I'm talking about, I don't know if I'm allowed to talk about it. It left so many people out that we were very disappointed. And I hope that this one, we wouldn't be that disappointed again. Like, you already know the challenges. Christine already said it. We don't have grant writers. Things are getting very difficult now as to who received the grant. I just hope that we will broaden that spectrum, but still recognize that we all need to serve everybody. I don't know. That's why I say it's a slash comment, a question. It's not a question. I'm just speaking because I thought about another grant that really broke my heart. And just like I'm always relaxed with always a grant, but they always break my heart sometimes when it comes to big grants. So I hope that you guys will do your best.
Thank you for your comment, Martha. And I do know the situation in which you speak about, and I think there were a lot of lessons learned from that situation as well. Um, and I think the reality is that, Oregon has a lot of needs, as you've mentioned. We have a lot. We are diverse. There's just a lot of people that need support, especially from organizations like yours and many others in this room. And so, in a perfect world, we could fund everyone, but the reality is that, funds are limited, and we'll try our best to really be intentional. And so again, I know we've said this a million times, it's like an old record. Please look at the RFGA, and please continue to, when you're doing your project plans, align with the health outcomes, and just make sure your projects are in alignment, because this will be probably this is the third cohort. This will probably be one of the most competitive cohorts that we've seen to date.
Yeah.
I have a last question. I know it's in the RFGA, but that's going to be a Saturday 4 hour with some tea and a sandwich read, because that's like a whole half day to read that whole thing. Where I know it is because I glanced through it. Where is OHA at in regards to, well, everything OHA is reimbursement? What does that look like? Because that determines how you plan your project. Is there, if a CBO is selected for something, is there upfront cost that they will fund? Is there upfront, or is it all everything reimbursement? And has OHA approved that all in its speed of reimbursement?
Christine, we don't do reimbursement. So with the current grantees, they receive monthly payments.
Okay.
That's our model.
And that will start when?
So for any organization that is selected, just to kind of give a brief timeline. So this grant will close August 22nd at 5 p.m. sharp. We will take a couple of months to review everything and make our decisions. Application, award letters, and denial letters will be sent out to organizations January, February. We're hoping to get them all sent in January, but it could be January, February. And because it takes a little bit of time to get like onboarded and processed, we hope to send first disbursements in March of 2026. That is our goal. So hopefully that helps you see the timeline and expectations. Okay, we're coming up on time, so I'm fine to sit in silence for a couple of minutes in case any questions come to mind. We're also watching the chat. Yes, Melanie. And I see your hand, Alejandro.
Hi again, this is Melanie. Thank you. So I know you showed us the portal where we access and complete the application, but I just wanted to be totally clear because when I was looking at the RFGP PDF, it talked about Oregon buys, but we don't go through Oregon buys to complete this, right? Just through the
No.
portal. Yeah,
Yes,
the portal you showed us today.
correct.
All right, thank you.
No problem. Oh, I don't know if Alejandro had a question or if he was waving goodbye. Okay.
Must have
Well,
been goodbye.
he was saying goodbye. Awesome. Well, we want to thank you for being here, for taking time out of your day, 2 hours out of your day, for being here and learning more about this grant opportunity. Thank you, everybody, for your questions. And we will be putting these responses in our FAQ document. If you just wanted to rewatch, not today's episode, but a previous recording, we do have a recording posted to our landing page right now, along with the slide deck in English and Spanish and all of the documents that we referenced today. So you have all of the tools that you need if you wanted to get started today. Again, our email, please email us with any questions. And we have multiple people monitoring that inbox, including Miss Jessica here. So we're capturing your questions and getting responses back to you as quickly as we can. So thank you. Thank you all for being here, and we appreciate your time.
Thank you too.